Adapalene gel is used to treat acne by decreasing the number and severity of acne pimples and promoting quick healing of pimples that do develop. It belongs to a class of medications called retinoids. It works by affecting the growth of cells and decreasing swelling and inflammation. It is best to apply a thin layer of adapalene gel to the affected area once daily in the evening, after washing the face. It is important to use it regularly in order to get the most benefit from it. If you are using the over-the-counter product to self-treat, make sure to carefully read and follow all the directions on the product package before using this medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Use this medication as directed by your doctor or the product package, usually once daily at bedtime. Before using, gently clean the affected skin with a mild or soapless cleanser and pat dry. If you are using the gel, cream, or lotion, wash your hands before and after applying this medication. Use your fingertips to apply a small amount of medication in a thin layer. If you are using the medicated swab, unwrap the swab and apply a thin layer to the affected areas. Use this medication on the skin only. Avoid getting this medication in your eyes or on your lips. Do not apply to the inner lip area or inside the nose/mouth. If this medication gets into your eyes, flush with large amounts of water. Call your doctor if eye irritation develops. Do not apply to cut, scraped, or sunburned areas, or to skin affected by eczema, a skin condition. During the first few weeks of using adapalene, your acne might appear worse because the medication is working on pimples forming inside the skin. It may take 8 to 12 weeks to notice results from this medication. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time each day. Do not use a larger amount or use it more often than directed. Your skin will not improve any faster, and your risk of developing side effects, such as redness, peeling, or pain, will increase. This medication is available in different strengths and forms, such as gel, cream, lotion. The best type of medication for you to use will depend on the condition of your skin and your response to treatment. Tell your doctor if your condition does not get better or if it gets worse. Since this drug is absorbed through the skin and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication. After applying the adapalene gel, you may feel a brief sensation of warmth or stinging. In the first 2 to 4 weeks of using the medication, you may also experience skin redness, dryness, itching, scaling, mild burning, or worsening of acne. These effects usually decrease with continued use. If any of these effects last or get worse, make sure to tell your doctor or pharmacist promptly. If your doctor has directed you to use this medication, it's because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, if you experience very red/irritated skin, an intense burning sensation, eye redness and watering, eyelid swelling, skin discoloration, or any symptoms of a serious allergic reaction, make sure to tell your doctor right away. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist. And if you have any concerns or questions about the medication, don't hesitate to talk to your doctor. Before using adapalene, it's important to let your doctor or pharmacist know if you have any allergies, especially to vitamin A-related drugs or if you have a history of eczema. This medication may make your skin more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen daily. Also, avoid hair removal methods such as electrolysis, waxing, and chemical depilatories on the treated areas while using this product. If you are pregnant, may become pregnant, or breastfeeding, it's important to talk to your doctor before using this medication as it may harm an unborn baby. And if you do become pregnant while using adapalene, discuss the potential risks and benefits with your doctor. It is important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor first. Additionally, it is recommended to avoid using other skin products that are harsh, irritating, or drying on the treated area while using adapalene gel. This includes products such as hair perming solutions, alcohol/lime/menthol containing products, medicated or abrasive soaps, and cosmetics with a strong drying effect. If you have recently used products containing sulfur, resorcinol, or salicylic acid, it is important to use adapalene with caution and wait until the effects of those products have decreased before using adapalene. If someone has taken too much adapalene gel and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to note that adapalene gel may be harmful if swallowed. It's important not to share this medication with others. You can still use cosmetics, but make sure to clean your skin thoroughly before applying the medication. Some cosmetics and soaps might make your acne worse, but moisturizers should be safe to use. When buying cosmetics, moisturizers, or other skin care products, look for non-comedogenic or non-acnogenic on the label, as these products are unlikely to make your acne worse. If you're unsure, ask your doctor or pharmacist for recommendations. And remember, acne is not caused by dirt, so cleaning your skin too often or too vigorously can actually irritate your skin and make your acne worse. If you forget to apply adapalene gel, you can apply it as soon as you remember on the same day. If you remember the next morning, then wait until your next scheduled application. When it comes to storing adapalene gel, it's important to keep it at room temperature and avoid freezing. Different forms of this medication may have different storage requirements, so make sure to read the package labeling or ask your pharmacist for the specific storage requirements for the product you are using. It's also important to note that gel preparations are flammable, so be sure to keep them away from heat or fire sources and avoid smoking during use. And as with all medications, be sure to keep adapalene gel away from children and pets. When it comes to discarding the product, make sure to properly dispose of it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.